Hi, I'm Dr. Scott Leune, and I interview people that are doing amazing things within dentistry. And today, I'm very excited because I am interviewing Dr. Lance Loveless. Dr. Loveless has focused his career on cosmetic dentistry, but then he found a way to also impact how the face ages. And when we can combine great cosmetic dentistry with great treatment for the face, we get the result that most of us are actually looking for. So what we're going to do today is go deep into this procedure that he developed called YuvaLift, where we get to learn exactly today's newest techniques, the innovative ways that we can impact aging of the face and the teeth. All right, Dr. Loveless, so thank you for joining me. Before we dive into YuvaLift and all the cool things you're doing with that, could we start by maybe you telling your story? Where are you from? What are you doing? How did you stumble onto this idea that you can go beyond cosmetic dentistry?
Great. Well, thanks, Scott, for that. So I went to dental school at UT San Antonio here and graduated 1997, moved to Austin, went to work for a big group dental practice there, a big corporate run practice. It was more about volume and less about patient care. And I always had this passion for cosmetic dentistry. I wanted to help people look better. Even in dental school, I remember having that passion. So I wasn't getting that where I was at. And I knew pretty quickly within a couple of years, I did not want to do that for the rest of my life, the rest of my career. So shortly after that, in 2000, I opened my own practice in Austin, Bridgeview Dental. It's still there. I'm still the sole owner of it. In fact, some of my team members one of them actually opened the doors with me. She's there with me. The others are there for, probably 20 years, 18 years. So immediately went into the cosmetic side of it. So I started learning how to do the prepped veneers, traditional prep veneers. And I was doing a lot of no prep veneers, which back then it wasn't in vogue. In fact, it was kind of looked down upon by the gurus saying you can't do no prep veneers because that's going to cause gum disease. They're too bulky. They don't look good. But I was doing them. My patients were loving them and it worked. And it looked great. So we were transforming these patients' smiles in their lives, and they were looking really good. And we were doing probably 50% no prep, 50% traditional prep. The prep veneers cases looked great as well. But that was building my brand and my cosmetic side of the practice. So I was getting a lot of referrals from these people, their family, their friends, their neighbors coming in, and they were wanting the same thing that their neighbor had or that the family had. But what I was finding was these patients, they were getting more and more challenging. It's like, wow, these patients, they've worn down their teeth, they're grinding, they're collapsed bite, and they want that length added back to their teeth. And I'm like, well, hold on. If I add this in pretty much overnight, what's going to keep you from breaking these or chipping them or popping them off or wearing them down? So I knew I had to have a different approach to treat these type of patients. I couldn't just throw cosmetic dentistry in there as a Band-Aid. So I started learning about neuromuscular dentistry, which is now called physiological dentistry. So that's where we get the muscles of the face in harmony with jaw position. So when I say jaw position, what I mean is if someone's wearing down their back teeth, and they're having to bite further and further up. And as you wear further, now your jaw's going further and further up. Their teeth are getting shorter. Well, the muscles that pull the jaw up are now in constant strain. It's like a bicep having to pull tight. And so that causes a collapse of the face. The lower third of the face gets shorter. And you see all this strain around the eyes because these muscles are overworking. They just look older than they actually show on their driver's license or their birth certificate.
So before we dive too deep, let's kind of review some of this because some people watching this may be unfamiliar with cosmetic dentistry in general. So you started out your career and you focused heavily on cosmetic dentistry, and you were doing so well with that and doing such beautiful work that you were getting a lot of referrals from people's family members and friends and colleagues. And as you built that practice out, you started to see much bigger issues.
Yes.
And you talked about how people can wear down their teeth completely so that their face gets sunken in. their bite gets deep and it ages their face dramatically.
Yes.
And that was kind of the first phase of your career. And most dentists never even do that phase. Most
Yeah.
dentists never become the cosmetic dentist that you became. But then you realized there's more to this than just building up teeth. We need to address what's aging the face. And so then you said you started going into something called neuromuscular dentistry
Hmm.
that is now not just addressing the way the teeth look, but also how they bite together to try to not age the face so much. Did I say that correctly?
Yes, that is.
Continue from there.
And not only that, but you mentioned the collapse of the lower third of the face, and that violates that golden proportion rule that nature has for beauty.
Yeah,
And it's everywhere in nature. The face has it, and you can see it in the eyes. You can see it. You can make these measurements. And so when you violate that lower third of the face, they look older. You always see people with no teeth,
Mm,
and they're kind of squinched up like that. Their chin is getting close to the tip of their nose, and they just look old.
yeah.
And you're like, you're surprised to hear that they're only 35 years old and they look 65, you know? So all of that plays a role, but also asymmetry. So a lot of patients, when they bite down, their jaw swings to one side or the other. And they don't know when they look in the mirror, but they're like, something just looks crooked. And usually the chin is off to one side or the other.
Yeah, so a patient like that that's worn their teeth down over time, they see their teeth and say, I wish my teeth were prettier. But you see more. And you can see that because their bite shrunk down or collapsed, it's created creases and folds in their face. And because their bite is off center, it's caused their whole face to look crooked. Enough that you can see that that's why they've aged, but not so much that maybe they even understand what's actually happened. Would you say it that way?
Yeah, that's exactly right.
Okay, and so as their face is kind of aging prematurely because of these dental problems, where do we go from there?
Well, so basically you want to find out where that lower jaw wants to be. And so that's kind of what led me to develop the YuvaLift. I was starting to do these bigger cases and figuring out where the jaw needed to be. And I was surprised to find out when we finished these cases, we gave them their beautiful smile, but I wanted to make sure that it lasted. I didn't want to put this in there and then 3 years later, these things are breaking.
Hmm.
There goes my reputation. So I'm like, we need to make these things last. So by doing this and restoring their bite to their ideal position, we were finding out that their faces looked better. I was not just fixing teeth, I was restoring balance to the whole face.
Okay, so if I'm to understand this correctly, you initially stumbled upon these better results because when you rebuilt the teeth, you also wanted to rebuild how they bit together. Because if they don't bite together properly, you can just the patient might just break everything you just put in their mouth.
Yeah.
So
Okay.
not only fixing the teeth, but fixing the bite makes that stable. But when you fix the bite in that unique way, you saw that the age went away, that
Yeah.
they became young again.
Yeah.
Because with that lower jaw in the right position, we don't shrink the face down, we don't sink the face in, we don't have the creases, and suddenly they look younger.
Yeah.
Is that what occurred?
That's right.
Okay, and so it's interesting then because some of that then means it's reversible. So if someone has a collapsed bite and you open the bite up to where it should be, the aging that we notice has now been reversed. Is
Yeah.
that safe to say?
Yeah. And if you're filling in, if they have a collapsed bite, then you're going to see that muscle strain in the eyes.
Hmm.
Well, we have now just relaxed all the muscles, and we don't just arbitrarily put them there. We actually hook them up to some EMG pads, like an EKG for a heart.
Mhm.
We can hook them up to all the muscles of the face that allow your jaw to open and close. And on a computer, we can see in real time their existing bite when they bite down, what that muscle activity is doing.
Mm.
And then when we get them in this nice relaxed position, you see the muscles just calm down. So especially as we age, or, we lose that collagen, that volume, the elastin in the face, skin gets thin. You've heard that. Well, that means that the muscle underneath the skin now has more of an effect on the surface of the skin. So
Mhm.
that's why people see all of these lines in their face, especially around their eyes, because the temporalis muscles are the ones that position the jaw right and left. And they're going in and they're getting Botox or filler or whatever, but they're not addressing the structural issue. The muscles are in hypertonicity. They're overacting. They're in constant strain.
Okay, so there's a few things here then. So one thing you said that is amazing is that a patient can come to you and with electrodes on the face, a computer can determine where that healthy bite should be.
Yes.
Not only is that amazing for what you're doing, but I'm now thinking about all the people that struggle with TMJ issues, with clicking or pain or lockjaw. I
Mhm.
bet that that would also help all of those people. Is that correct?
Yeah, I use the same technique. In
Mhm.
fact, there's a little bit of a deviation, but they
Mhm.
come through the practice kind of the same way.
Yeah.
And some of them come in strictly for cosmetics with no symptoms, but then we hook them up to the computer and we see the muscles are like crazy angry. And
Yeah.
we're like, you're predisposed for TMJ. Imagine if I would have just put veneers in that situation. Now, all of a sudden, I just sent them into an overload and now they're full blown symptomatic.
Yeah.
But the TMJ patients come in the same way, hook them up to the computer. We find out where their jaw wants to be,
Mm.
where these muscles are relaxed. And when you get everything in harmony, you get the teeth, the jaw, the bite, the joints, which you hear people have popping and clicking. Well, that's because this bone is shoved too far back. Well, why would it be shoved too far back? Because they've worn down their teeth and their jaw's going all the way back here. Well, you relieve that pressure, let the jaw kind of relax, and then that takes the pressure off that. The clicking goes away.
Mhm.
The eyes look better. So we've got this cosmetic effect as well as this functional effect.
So, almost like an analogy, a lot of people suffer from back problems. And when they go get seen, all the muscles are tensed up and they're contracting and their back is out of whack and it's putting all this pressure and they're feeling nerve pain and they don't have good posture. And it's all because the musculature is, for whatever reason, is contracting too much.
Yep.
In a similar way, if the bite is different or off, the jaw's in the wrong position, the muscles of the face can contract, and that can cause pain in the joints, and it can cause premature aging and wrinkling of the face,
Mhm.
correct?
And
And so,
asymmetry.
yeah, so this machine you use, I would say anyone listening to this right now, if they're interested in cosmetic dentistry, if they're interested in looking younger in the face or not aging so fast, and if they've got any sort of bite symptoms, they need to be hooked up to this machine
Yep.
because now with a computer, you know finally exactly where it should be.
Yep.
So that's really interesting. The other interesting thing you said is that a lot of people are getting Botox, which i- is a toxin,
Yeah.
right?
Yeah.
And so they're putting a toxin in their face to paralyze these muscles. And that's really just covering up the real problem. The real
Mhm.
problem is that the muscles shouldn't be firing like that to begin with.
Correct.
And so when the jaw and the teeth and the bite are in the wrong spot, all the muscles, even up here, are firing so much that it ages us. And some people get Botox for the rest of their life to try to turn that muscle off. And it doesn't even look very natural
Right.
sometimes.
Right.
It freezes their face.
Yeah.
But you're saying if we can fix the positioning, we can loosen those muscles, and maybe we never needed to use a toxin to paralyze our face.
Yeah.
That we could have,
Toxin or filler or any of those injectables.
yeah.
So, I mean, our before and afters, it looks like they had a facelift. I mean, in fact, it's been coined kind of a no knife facelift.
Mm,
Very conservative approach.
mm,
You're not having to go under surgery, general anesthesia, uh, be under the knife with a scalpel, sutures, all that stuff. And all that really does is stretch the skin.
mm.
You get a facelift and, it stretches the skin.
And your muscles are still firing
Your
like they should.
muscles are still firing and your jaw, you never fix the structural issue. So you still have that structural aging, is what I call it. The underneath part is still aging. You never corrected that. In fact, I just had a patient this week. She just finished the YuvaLift, but she came in through the TMJ route of the practice. She had a facelift. She's in her late 70s, had a facelift probably 4 or 5 years ago. And she had severe TMJ. Her face looked great,
Mm,
but she would bite down and she would get this shooting pain.
mm,
It would just stop her in mid tracks. So we ran her through the same protocol, found out where her jaw needed to be, and come to find out her upper teeth had been so worn down that not only was her jaw up and collapsed, but it canted up like this just to get the teeth to touch.
mm,
And you do that thousands of times a day when you're eating, when you're swallowing.
mm,
So we ran her through that same process. We just finished her case up and her results looked fantastic. So it
mm.
complemented her facelift because now she had this overclosed jaw, we've actually corrected that. So her lower third of her face looks good. The side that she was overclosed on, her chin was off to that side. And you could see it in her eyes. The muscles were strained, but she had her facelift. They pulled everything tight, but they didn't address the structural issues. So now the muscles are relaxed, the jaw's symmetrical, centered with the chin, and all of that occlusal plane or the bite plane where the teeth line up, they're all nice and even where the lower jaw supports that ideal position.
So maybe a great way of thinking about this, if I'm someone that doesn't know about dentistry, is the way the face looks at the foundation is where the jaw sits and is the bite correct.
Mm-hmm.
When it's correct, everything's relaxed and we look younger.
Yep.
When it's incorrect, everything is tense and crooked and wrinkled and
Yep.
we look older.
Yep.
And that's the foundation. And what most people, without your procedure, without the YuvaLift, what most people have been doing is taking their broken foundation with cracked walls in their house and trying to facelift the wall, put paint on the wall,
Yep.
but without fixing the problem, the cause of it.
Yeah.
With the foundation is the bite,
Yeah.
where the jaw is. So you found a way with YuvaLift to address with technology, exactly where the bite should be, and then build a beautiful smile with cosmetic dentistry.
Yep.
And relax the face and take away years of aging.
Yep.
Did I say that correctly?
Yeah. And that is, I mean, if you're going to spend the money, cosmetic dentistry is expensive, and if you're going to spend that kind of money, invest that kind of time and money in it, why not address the whole face? It's almost like the face is a jigsaw puzzle. This smile is one piece of that jigsaw puzzle. Why not address everything else? Get the golden proportion correct, get the chin lined up, the symmetry, relax the muscles. You always see it in the eyes. The eyes just seem so relaxed. The patient smiles with their eyes. When you don't correct all that, they smile. They have a beautiful smile, but they're smiling with their smile instead of their eyes.
Well, if they've got Botox, they can't
they're not
smile with their eyes either.
yeah.
Right? So it sounds to me like you have to have all three. You have to have the right structural foundation. You have to have beautiful teeth, and you have to have a youthful, relaxed face.
Yeah.
And when you have that, nothing breaks, nothing causes pain, nothing prematurely ages.
Yep.
But what people are doing instead is they're just getting Botox. Well, they still have all the tense muscles when the Botox wears off and their smile isn't great.
Yeah.
Or instead, they're just getting cosmetic dentistry. Well, that's going to break because the foundation's wrong and they're still aging, right? Or they have some symptoms in the jaw and they're trying to treat that, but they're not addressing the overall youthful appearance of their face. So maybe this might be the first time where we've combined the medicine side of the face with the dental side of the face to give a healthy, youthful outcome.
Yeah.
That's a big deal.
Yeah.
Could you, in your words, describe as shortly as possible, in the most simple way possible, what is YuvaLift?
All right. Well, so YuvaLifts, actually the word YuvaLift, how I came up with that, there's an ancient language called Sanskrit, and the root word yuva means youthful or prime of your life. And I put that together with lift, and we got YuvaLift. So that's how I came up with that. But it's just it's a method that I've developed. I trademarked and I've been perfecting probably for 2 decades. I mean, I've been tweaking it and tweaking it and tweaking it ever since the first time I saw that facial aesthetic improvement, helping someone get the smile they wanted. I've been trying to pursue that. And we've added and added and added. And this last year, we added something even new to it, which is fantastic. It helps with the facial aesthetics as well. Builds collagen, elastin, hyaluronic acid naturally in the face. So you're not injecting this stuff. We're actually stimulating your face to produce it, your skin, your muscles. The muscles themselves, we stimulate those, the elevator muscles, to kind of give your cheeks a little bit of a lift. So it stretches this out. But YuvaLift's just the method that I've put together that creates or restores, I guess, not creates, but restores the harmony of the face. What you used to have before the bite collapsed and before all the teeth wore down. Or maybe your face has never been symmetrical. Maybe the teeth are the door stoppers. The door swings open and it stops. So you could have a door stopper that's too short, in a different position, and that door is going to swing open, and it might swing open too far. because the door stoppers aren't in the right position.
Mhm.
So put the door stoppers, which analogy of the teeth, put them in the right position so it supports that ideal jaw position.
Okay, so for this, it was groundbreaking to me. And I'm a trained dentist as well. And I know dentists all over the world. I interview innovative dentists all the time. It's what I do. And this made my list of what I had to know about. So before I kind of ask more questions about it or give my synopsis of what YuvaLift is, I would love to know your words. What is YuvaLift? If someone asks you, not a dentist, but a patient, what is YuvaLift? What's your answer to that?
Well, so especially a dentist, they understand all this stuff,
Mhm.
or most of it, or maybe they don't. But we get these patients come in, they've got this collapsed bite.
Mhm.
We need to do basically three different steps. First step is find out where that lower jaw needs to be,
Mhm.
where everything is in harmony, where the muscles are in their physiological position. Every muscle has a physiological length they want to be at, and any skeletal muscle, just like a bicep. So you don't want an overcontracted bicep. Well, you don't want an overcontracted muscles of the face. So we need to find that rest position of all the muscles,
Mhm.
and that jaw will swing around to a position where all those muscles are relaxed.
Mhm.
We capture that position, and we with a test bite, and then we hook you up to a computer and we read those muscles in real time, and we see, are all the muscles calm, are they relaxed, are they physiological rest position?
Mhm.
If they are, then we move forward with that. And that's where you start seeing the facial changes, because we take this test bite, it lines everything up, looks great. So now we use just some beautiful porcelain work. We do this cosmetic dentistry that they want. They want that beautiful smile. But now we build it into this new position where the face is relaxed.
Mhm.
And so now all the muscles are calm, the face is calm, everything is symmetrical. We've reestablished the golden proportion of the lower third of the face. Everything gets filled out. These sunken lines get filled out by
Mhm.
the teeth themselves. I can feel teeth when I push here. All the lines are starting to disappear. And then to top it off, the last step is we use a very, very innovative piece of equipment. That equipment is called InFace. We put that on their little pads and we put them on the areas of the face. That's going to stimulate the skin to produce elastin and collagen. So all of those areas where you had the wrinkles from those overactive muscles from the bad bite position or the collapsed bite position, now that that's not collapsed, your body can now fill that in naturally. We're not injecting anything. We're not having to use Botox. You're actually filling those areas in naturally. Your body heals. And
Mhm.
so now they get that beautiful smile that they've always wanted, and it fills all the way up, upper, lower teeth. It looks fantastic, but
Mhm.
now their face follows. So that form follows function. Once you get the function correctly of the lower jaw and you get everything functioning correctly, the face looks great.
Okay, so I'm going to coming in. They might have pain in the jaw. They might have teeth that are not pretty anymore. They might have a face that has aged more than they want. And they're coming to you and receiving YuvaLift. YuvaLift is three main steps. You use a computer and some advanced studying to get the jaw in the perfect position, finally in the perfect position where it should have always been. Then you use beautiful cosmetic dentistry to build the teeth into that perfect bite. So we've got a perfect bite, we've got beautiful teeth, and that relaxes all the muscles of the face that were wrinkling and aging the face. Then you go in with an advanced facial aesthetics procedure that's painless, and you are able to help the face rebuild collagen to naturally get rid of the wrinkles. No filler needed, no Botox, no cosmetic dentistry that breaks, no jaw pain. We fixed it all with YuvaLift.
Yep.
So, step one, fix the bite. Step two, have a beautiful smile. And step three, utilize advanced facial aesthetics to get rid of the wrinkles.
Yep.
And the result of that is long lasting because the foundation of the problem was fixed.
Yep.
Never in dentistry have I seen someone take those three approaches and bake this beautiful apple pie with it.
That's you.
Everyone else is doing one thing or the other and wondering why the results aren't what they should be.
Yep.
You finally got the full recipe to bake this apple pie, YuvaLift, and have the best result possible.
Yep.
That's amazing.
Couldn't have said it better myself.
So Dr. Loveless, I know a lot of people assume that aging is about wrinkles.
Yeah. Yeah.
What is it really about?
Well, I mean, there's truth to that. Wrinkles make you look older, but in my world, it's strained muscles that are actually causing the skin to wrinkle up.
Mhm. So strained muscles cause the skin to wrinkle, cause the jaw to be in the wrong spot, cause the teeth to wear down.
Yep.
Whereas if we didn't have strained muscles, the skin wouldn't wrinkle like it does. The teeth wouldn't wear down like they do, and we would just look younger. Did I
Yep.
say that correctly?
That's correct.
So the world of facial aesthetics or med spa has just exploded in growth. And it seems like so many people are getting lights on their face or
Yeah.
patches and spending all of this money chasing youth. And, it doesn't seem like it's working in a way where people are looking natural and beautiful
Yeah.
all the time. Are they patching this up instead of fixing the problem?
Yeah. So basically, I mean, that's a huge industry. I think
Yeah.
last time I checked, it was 15 billion on that annually spent on that. And that's not even including more advanced stuff like laser therapy and
Facelifts
full
and things like
You
that.
throw
Yeah.
facelifts in there, and now you're in probably $80 billion annually worldwide spent on that. And you never really address the root cause, the structural aging part of it. So you're treating the surface, you're treating, the skin or the wrinkles, but you're really not addressing the root cause.
Mhm.
With YuvaLift, you're actually addressing the root cause. So you're not just putting a Band-Aid on it. And that's why this stuff doesn't last. I mean, it wears off and you're back to where you were.
Mm.
More filler, more Botox. And you're going to do that your whole life? No. So you want to get that jaw in the right position, get the structure support correct. And then all of a sudden you don't need all of that stuff. Or if you do, you need a lot less of it.
Yeah. So I'm going to think, from a guy's perspective, an analogy, if I've got a car where the tires are out of balance, they maybe even be tilted a bit. As I drive that car, the tire itself is going to wear down in a weird way. What should I do? It seems like with the face, people have just been putting on a new tire.
Yeah.
And it'll be okay for a while until it's not. But what we should do is fix the problem. And the problem was the tire is mounted at an angle.
Yeah.
We need to rebalance the tires so they don't keep wearing down. So it sounds to me like the foundation of our face has been broken for many of us. And the result of that is aging. And instead of fixing the problem, people have just been patching up the aging.
Yeah.
And spending a fortune and going under the knife or lasers or injections or putting fake things into the face to try to mask the result of the problem.
Yeah.
But you figured out how to solve the problem. And not only did you figure it out, but you also combined it with fixing the smile.
Yeah.
So if the smile were a painting, you figured out how to paint the most beautiful painting, but you've also figured out how to have the most beautiful frame around it, the face.
That's exactly right. Yep.
Okay, so let's talk about what patients would benefit from YuvaLift. Because we've got some patients that are, of course, getting in their older years and they'd really like to roll back the clock. We've also got patients that have problems. They have pain or they're broken teeth, or we may even have patients that are younger. They don't seem to have many dental issues. They don't seem to have much pain, but they're still thinking maybe I need Botox or things like that. So we got the whole range here of people. Which one of those patients is going to be a candidate for YuvaLift?
So really any of them. I think I just told you that story about the 70-year-old had a facelift and now she's going through YuvaLift and her results were fantastic. So it complemented her facelift. I'm not saying you should do that. I would say do the YuvaLift, see what your results are. And maybe you don't need a facelift and you can avoid that. Then I get patients that are in their 30s. In fact, I had a young guy, he was probably 31, 32, severely worn teeth, and his jaw was way off to one side, overclosed on that side. And I swear, if I would have just looked at his teeth and not him as a person, I would have said he was 55, 60, 65 years old. but he was in his early 30s, maybe 31, 32. He came in, he wanted veneers, ran him through the whole process, read the muscles. There's no way I'm putting veneers in this situation. These will not last.
Hmm.
So we basically did the YuvaLift, got his jaw in the right position. His chin that was way off to that side now was centered, lined up with his face. And he was in his early 30s. He went on to law school and became a successful lawyer. Beautiful smile. I mean, we've got pictures of him in all of our magazines and things like that. And he loved his results, but better yet, I gave him his facial structure back and I lined everything up. So now it's going to last.
Yeah. So it sounds like every patient that is looking in the mirror and saying, you know what, I'd like to either roll back time or maybe I want to prevent aging. Every patient should be at least screened or evaluated for YuvaLift, because without that screening, you won't know if the bite is actually causing the aging or not.
Yes.
So every patient would come in, get screening, and maybe they need YuvaLift. Maybe they just need something on the cosmetic dental side. Maybe the bite's great, and maybe they just need a skin procedure. Would it be safe to say that?
Yeah. Yeah, that's perfect.
And you know, it's interesting because as a medical professional, we can look at someone's teeth or face or bite and say something like, they've got the teeth of a 70-year-old, but they're only 30.
Yes.
But patients don't quite know that, right? So they may want things better, but they don't quite understand how good or bad is it. So anyone listening to this, I just really encourage you, with everything changing in medicine today, with everything we're learning that the old way of doing things was the wrong way sometimes, and that there's new ways that are amazing. With everything that's changing, the responsible thing to do would be to screen for YuvaLift to see if you've got a foundational problem that is going to age you faster over the years. And hopefully we don't. Hopefully we don't have that problem. But if we do, thank goodness we found out, so that we can have that fixed and prevent the aging, as opposed to being someone that's constantly injecting and cutting and lasering our face, trying to figure out how to fix this. So, you know, from my experience, this anti-aging movement started with plastic surgery of the face, you know, and for years, people have been getting facelifts and gosh, some of them just don't look too good. And then, of course, they're using things like lasers and Botox and fillers, and we don't even quite know how healthy some of that stuff is long-term. All of that costs a lot of money. It can be painful. People could be out of work. YuvaLift, where does YuvaLift fall in kind of the cost and pain and time spectrum? Is YuvaLift on par with the cost of a facelift, or is it a lot more? Is it less, or how does that work?
Well, it's on par with any of these other major plastic surgery procedures, but you hit the nail on the head. I mean, you're talking surgery, knife, sutures, long healing time, maybe even permanent numbness of some areas of the face. And so that's a high risk procedure. We're doing something much more conservative. It's cost-wise, yeah, it's expensive, but you're addressing so many more things, and you're getting that beautiful smile that you get to take around everywhere with you. You travel with it, you take into restaurants with it, you get to smile and enjoy that smile, but now you got your face fixed as well, because the jaw's where it needs to be.
So it seems to me like a facelift has risks, it has pain, you're under the knife, you have an extreme result that may not be natural, and it didn't do anything about the problem, the bite, the muscles, or the teeth.
Yep.
And it seems like YuvaLift is a similar cost, but much more conservative.
Yep.
And not only is the face different in a natural way, but the teeth are beautiful now, and the bite's in the correct spot.
Yep.
There's a lot more value there, and it's a lot more natural. And it seems like that's actually what we've always wanted. We were trying to get there by patching things up with a knife, you know, in surgery. But you were able to figure out the ingredients needed to put this together and actually get a natural result that lasts.
Yeah.
That's amazing.
Yeah. And one thing, you bring that up as far as looking different. That's one of the big questions patients have. They ask me, I don't want to look different. I don't want to look like I had a facelift or like I had quote unquote work done.
Right.
And I'm like, you are going to look like your younger self. You are going to look like yourself, just with a better version, with everything symmetrical and your face looking good, the teeth looking good, but it's still going to be you. It's not going to look like someone else. And if you add up all of I mean, how long are you going to do Botox? It wears off in 3 to 4 months.
Yeah.
And then every time it wears off sooner and you're getting filler put in, that dissolves. Where's that going? Your body's absorbing that. So over your lifetime, you're spending how much on that? And
it's not natural. When people smile, their eyes don't move, their foreheads don't move,
I can't tell if
their lips look off, and
yeah, or if they can't smile with their lips, and it's like this. I want to give your lip support so you actually get a natural plump to the upper lip without filler. I want these nasolabial folds here to be filled out without having to stick filler in there every 6 months or something like that. I want all these muscles relaxed without having to inject Botox. And who knows what that does to you for the rest of your life,
Yeah.
So you add up all those costs, and the initial cost is pretty high, but it's on par with all of that stuff. If that's your goal, to look natural and look facially aesthetic, then this is on par with all of those procedures.
So you said it in an interesting way. People are saying, I don't want to look like I've had a facelift. Well, don't get a facelift.
Yeah.
I want to look natural. Well, then don't put unnatural things in your body to paralyze your face, right? I want to look like my younger self. Well, then put the structure of the face back where it should be and fix the things that broke. And that's what you do. Yeah. So you are giving a result with YuvaLift that is a younger version of the patient. It is their natural, younger looking self, not an unnatural, Botox paralyzed, filler injected, skin stretched, facelift result.
Yep.
It is a younger, natural result because you fixed the problem.
Yep.
That's amazing.
That's exactly right.
So Dr. Loveless, what's the one thing most people don't realize about why their face might be aging?
Well, probably that their jaw is in a wrong position that is prematurely aging their face by 10 to 20 years. They don't realize that.
So if their bite's in the wrong spot, their skin and their muscles will age by 10 or 20 years.
Yeah, I see it every day.
So what are some signs or symptoms that I might have if my bite is wrong and my bite is aging my face? How might I know that's actually happening?
Well, first off, your teeth are going to be appearing shorter, or you're going to be showing less of your teeth. What that tells me is that you're wearing down your teeth, your bite is collapsing, and it's squinching up the face.
Okay, so if I look in the mirror and my teeth are worn down and they're shorter, that's the big red flag that says my bite's probably wrong and it has already started aging me.
Yes, because if your bite is too collapsed, then I know your muscles are going to be overworking, and that's going to cause the skin wrinkles that you see, and it ages your face.
So one thing I read about YuvaLift that I thought was a really cool aspect of it is you had said that patients are able to test drive the YuvaLift before it's permanent. Could you kind of explain what that means?
Yeah, so basically they're test driving their new bite position. So where we've established that their jaw needs to be, where their facial muscles are relaxed and where the symmetry is correct, they get to test drive that. We've create a bite for them. They leave with it. They can show their significant other. They can wear it around. They can wear it to bed. I've had a lot of patients sleep with it because their jaw just feels so much more relaxed. That's the common thing I get, is that everything just feels relaxed. I love this position. So they get to test drive that. And I always have them take a profile photo as well, because they see the facial change from a profile standpoint versus just straight on. And it's dramatic. You get this jawline and now it's all defined. It looks fantastic versus when they were over closed, their jawline disappeared.
So with YuvaLift and using the technology on the computer, you're able to find the perfect spot for the bite, and then a patient can test that. You build them a bite and they can go for days or weeks testing the bite, see how they like it. And you said that it completely relaxes them, that they get this now beautiful kind of jawline that most of us wish we had.
Right.
And they come back to you and say, yes, this feels right. You do all of that before you make it permanent.
Yeah.
That's amazing. So if there's some small adjustments that need to be made, patient kind of wants a little this or a little that, you're able to make those adjustments and work that out before you make it permanent, correct?
That is correct. So I'd never want to jump in and do something permanent that we can't undo
Mm.
until we verify that this is the correct position and that the patient wants to move forward. So they're not committed to doing anything permanent. So they can come in for their screening. We do a test bite, confirm it on the computer. They still don't have to decide to do it. But once they see the changes and they can feel the difference that it makes, they're usually all in.
So having done all of these cases over the last 20 years and perfected this procedure, YuvaLift, I bet you've seen some pretty dramatic results, emotional results, and a lot of people, I would imagine, say similar things. And I'm curious, what might be the first one or two things someone notices when they are finished with the YuvaLift procedure and they look in the mirror?
Well, you would think it would be the teeth. That's what, they wanted, a beautiful smile. But I'll tell you, the very number one response I get is my face feels relaxed. I always felt like I was in tension, and it just feels so good. That's the first thing they notice right off the bat. And then they do notice the teeth because it's beautiful dentistry. They got their smile makeover, but they notice the face. So they're noticing all the changes that were made in the face, not just the teeth and the smile. And that's what makes this procedure so much different. We're not just focused on teeth, we're focused on the whole face and getting the system in balance.
So they're getting a smile makeover and they are getting a non-surgical face makeover
Yes.
in a natural way. And so when they come out of that, they notice that functionally, it feels amazing. Dentally, it looks beautiful. And the face looks more youthful in a natural way.
Yep.
That's amazing. So, cosmetic dentistry has been around forever. I remember the TV show Extreme Makeover with Dr. Bill Dorfman and just doing these instant orthodontics, he called it, all these veneers and cutting down teeth and just doing these huge cosmetic cases. And from that point, a lot of people have been getting cosmetic dentistry. Celebrities get veneers, you hear about, and all these things. But now knowing what we know, especially with YuvaLift, they might have been getting cosmetic dentistry on a broken foundation.
Yep.
So I want to ask you then, what do you see as one of or some of the biggest mistakes people make when they go to a dentist to just get cosmetic dentistry done?
Well, they're focusing only on the teeth. And they're just focused on the cosmetic. Remember the jigsaw puzzle, they're only addressing one part of that puzzle. They're not addressing the whole system. And if you put these beautiful, there's a lot of cosmetic dentists that do fantastic work, but if you don't correct the jaw position and fix that collapsed bite, you're really not addressing the whole system. You're not getting the facial aesthetics back. So you're missing out on all of that. You're getting a good smile, but it may not last. You may actually end up breaking it if you've got a collapsed bite.
Yeah. So when someone gets cosmetic dentistry done and they're only focused on the teeth, they're not doing YuvaLift, then they're going to have beautiful work done with a bad bite, and that can break the work.
Yep.
They're going to have beautiful work done with a bad bite, and that's going to keep aging them. And that bad bite is also going to make them feel tense. I'm curious what you think then. Would it be the same answer when someone goes to a plastic surgeon and they want a facelift, but they don't want to look like they had one, and they're not thinking about anything else? Do you see that as the same mistake?
Yes, 100%, because they didn't address the collapsed bite or the asymmetry in the face. Plastic surgery is not going to correct a chin that's off to one side because that's where they bite. It's not going to correct the collapsed lower third of the face, the violation of that golden proportion. It's just going to pull everything tight. And so, you're pulling the skin tight, but you really didn't fix that foundational issue, the structural aging that's going on.
Yeah, so of course, this is going to sound kind of simple and funny in a way, but we've got skin, and underneath the skin, we've got muscle and bones. And if the muscle and bones are in the wrong spot, then no matter what we do with the skin, we're going to have problems for the rest of our life.
Yep.
And on top of that, when the muscle and bones are in the wrong spot, the teeth break down. And so we can go from, age 35 to age 45, but our face aged 20 years, not 10, because the teeth broke, the jaw's in the wrong spot, the muscles are tense, and we've just created wrinkles everywhere.
Yeah.
And we think, let me just stretch it or paralyze it, and maybe that'll help. And it just doesn't look natural.
Yep.
So with YuvaLift, You are fixing the bone position, loosening and relaxing the muscles, and giving the body a chance to get rid of its own wrinkles with collagen
Yep.
while giving a smile makeover.
Yep. Total package.
All right, well, Dr. Lance Loveless, I cannot thank you enough for sitting with me, allowing me to interview you and kind of pull back the curtain on what YuvaLift is. And it's not often that I talk to someone and feel like they've truly stumbled on something that has completely changed how we're going to do it in the future, but you did. YuvaLift to me is finally the natural way to fix the problems that cause aging, the problems that cause the teeth to break down. You fixed the problem that causes it, while everyone else was trying to patch up the effect of the problem. And that is truly amazing. This is one of the moments in dentistry where we can now start a new chapter. We're not just going to fix teeth just to watch things break down and to watch the faces continue to age. We're going to actually fix the foundation and completely change the lives of patients in a very natural way. That's amazing. Before we wrap this up, is there any last thing you want to mention or anything that I didn't ask you, I should have asked you, or anything you want to say?
No, I think we covered everything. I mean, I appreciate the platform. I appreciate getting the word out.
Mm-hmm.
I want people to know that there's a different solution out there than just going under the knife.
Mm-hmm.
It's a much more conservative approach, and I just glad to have this opportunity to spread the word.
Now, I'm curious if a patient wants to be evaluated by you to see if they'd be a candidate for this, or maybe they've got worn down teeth, or they've got jaw pain, or they were thinking about plastic surgery. How would they get a hold of you? How could they connect with you on this?
Well, obviously, I've got a website, and it's drlanceloveless.com.
Mm-hmm.
You can, my favorite way for you to reach me is start off with a virtual consult. I don't know if you've heard of those, but we do those in our office, and the patient can use their phone, their iPhone, they take it out, take a picture, full face photo, close up of their smile. And through my app, they can send it in to me, type in a few notes as far as what they want changed, what they don't like. And it's amazing. I can sit down, I can record a personalized video back to you. I can give you options. I can give you prices. So before you even invest time and gas money and everything to drive over to a doctor's office that you've never met and risk being hard sold on anything, you do this. I give you all your options, your prices, what that might look like. I can even do a simulated before and after. I can use your existing photo. I can do a simulated after, send that to you, and you can preview that. And that's exciting. But that's the best way to kind of enter into the office, because then once you hear, you know, what my options are, what the costs are, and I'm all in on that. By then, you schedule an appointment for that full face assessment, and we use AI technology for that. And we do a facial mapping, and we see where all the asymmetry is in the face. And then from there, we do the test bite, and you're still not committed at that point. So that's the best route to come into the practice to evaluate.
Okay, so let me make sure I understand what you're saying. And this is so convenient. So you're saying no matter where I live in the country, I could send you a few photos on an app. You will review them and walk me through what you think I might need, personalized to me. And I don't have to fly to you or drive to you or take time off to do this. I can understand, am I a candidate, or what should I expect, without having to leave my home. And then if I am a candidate and I decide I want to do this, I come see you, and through AI and simulations and computer measuring, you can do the full assessment on me. And I can truly understand what it would look like, what it would cost, what I could expect before I then decide to finally move forward with everything or not. Did I say that correctly?
Yeah. But even what it's going to feel like. So
because of the test drive, the test bite. Yeah.
I want them to see how relaxed their face feels having that in there.
So anyone that's considering cosmetic dentistry right now, or anyone that's considering a facelift, should do this virtual consultation with you first, just to make sure they're not losing out on the right treatment.
Yep.
This is so easy and it's so valuable. And so I want to thank you for that as well. That is so convenient for patients. I wish other physicians, I wish other dentists did that.
Yeah.
Okay, so they can get a hold of you on drlanceloveless.com. Doctor, is it spelled out or
Either
DR?
one, DR
Okay, or
or
doctor.
spelled
Okay,
out. Made
so
it easy.
perfect. So they can get a hold of you on drlanceloveless.com and they can connect with you that way and potentially do this virtual consultation. Well, again, I want to thank you for doing this. I want to thank you for the YuvaLift procedure and what you're doing for dentistry, and of course, what you're doing for your patients, and just the time you gave me to allow me to interview you and learn more about this.
Yeah.
Those of y'all watching, I hope this was informative for you and interesting. You know, we do these videos from time to time whenever we find something truly innovative, truly like a leader in the field. And so, of course, watch out for more of these videos. But this was a very significant one. Thank you so much.
Thanks, Scott.